I am Dr. Vijay Bhaskar, Masters in Orthopedic. Today we will discuss the pain dragging from the neck to shoulders. This is the common complaint we see in the youth as well as the older people. What exactly we need to know is the neck is the most important part of the human body. It has vertebral bodies, it has discs in between the vertebral bodies, it has the facet joints which join together two vertebra, it has a spinous process, it has the spinal cord, and it has nerve roots which comes out of the neural foramina from the left and right. And apart from that, we see lot of ligaments, muscles and nerves, and then the neurovascular bundle passes through the neck. So many times we heard that about the spondylosis. Spondylosis is the disease is degeneration of the bone because of the age process, which caused because of the osteoporosis. That means the bone mineralization is reduced, and softening of bone leads to degeneration of bone. Formation of osteophytes is called spondylosis. The next disease is called spondylitis, is nothing but the two facet joints in the between the two vertebral body which joins. The inflammation causes the joints leads to spondylitis, either because of the function of the joints. Sometimes there will be irritation in the joints lead to inflammation, sometimes infection also causes this, and certain biomechanical pressure also causes the inflammation in the facet joints. And then we can commonly think about the disc. The disc is the structure which has a rubbery circular annular ligament with a gel-like tissue in between inside the disc. So commonly we hear about disc prolapse. The disc prolapse is nothing but the rupture of this disc causing the pressure on the roots or the cord backward. What I mean to say, this disc ring gets ruptured and the gel-like tissue comes out and puts the pressure on the nerve root or the spinal cord, lead to a pain in the neck, shoulder and the hands. So typically the disc prolapse is the commonest cause in the neck pain after the spondylosis or spondylitis. Apart from that, we see bone tumors, we see spinal cord tumors, we see infections of the bone, that is osteomyelitis, tuberculosis infection, and there is a immunological disorders like rheumatoid arthritis also causes the damage to the facet joints. These are the various causes for the pain which we need to investigate and manage accordingly. When there is a spondylosis, it could be injury to the neck in younger age, or it could be degeneration in older age. Irrespective of it, the spondylosis cause should be treated or attended very well, and then supplements with the anti-inflammatory tablets or painkillers, neck support definitely helps to relieve the pain. Correction of osteoporosis is most important in spondylosis. When there is a facet joint inflammation is called spondylitis, that should be treated with a rest to the part with a collar, anti-inflammatory NSAIDs or painkillers, and then a sort of a physiotherapy which decreases the pressure in the facet joints and rest to the part. Apart from that, we should rule out whether it's any immunological disorder like rheumatoid arthritis, should be treated accordingly. So the disc prolapse, where the disc is pressed on the back side of the nerve root or cord, should ruled out with the MRI, and then according to the cause or a pressure in the root or cord, either it can be treated non-operatively or conservatively or surgical has to be decided. Then we should take care of with certain conservative management or surgical management. Bone tumors should be diagnosed and then treated either conservatively or surgically. And then the infections like bacterial infection treated antibacterial therapy, tuberculosis bone should be treated with anti-tuberculous treatment. Thus, we can control the pain in the neck as well as the shoulders.